Restricting visitation to our state's nursing homes and assisted living facilities back in March was a heartbreaking necessity, but it was the most effective way to contain the spread of COVID-19 and to save the lives of our state's elderly and at-risk residents. As you know, we've had a lot of elderly people in our nursing homes who pass away during the virus. As expected, the months of the separation and isolation have caused loneliness, depression, stress, anxiety among the residents, and I worry about them like you do every day. I worry about their physical and mental and emotional health as you do every day, and as their loved ones do every day. It's been frustrating for all of those who are worried about a parent, grandparent, or their loved one's well-being. I've spoken with them, perhaps you have too. I've read numerous letters, I've had phone calls, I've had face-to-face conversations, and I've heard the pain and frustration in their voices and in their words. We know that we have no policy or procedure that can eliminate all possibility of risk. We can't do it. But the time has come, based on what we've learned, what we've experienced, to reunite our family members, loved ones, and caregivers safely as best we can. You might recall that back in June, right after I'd asked the Department of Health and Environmental Control to develop visitation guidelines for the nursing homes and assisted living facilities, that we had to postpone releasing them due to the rising rate of infection and hospitalization. I've told you before, we had the executives and representatives of all the hospitals in the state, I believe, at one time in the conference room expressing their concerns about that rising rate and the possibility of a lack of hospital availability. So that's why we postponed that measure at that time. We are committed to protecting the physical, mental, and emotional health of our elderly and at-risk people and their loved ones. The guidelines that DHEC has developed will require a number of things, as they will explain to you. They will require the testing of every resident, the testing of every staff member, and there will be repeated tests there, and there will be testing for visitors. Strict rules and procedures must be followed if this is going to work. Facilities will be monitored by both DHEC and the Department of Aging's Ombudsman, who is here today. They have a program for monitoring compliance. Recently, the Department of Aging created a working task force. As visitation resumes, they will be monitoring this progress and the process under this process, and they will take public input and make additional suggestions to DHEC on needed policies or procedures. So this is another situation where we have everyone involved to see that we're doing the best we can in following the rules of safety. The last thing that any of us here or any of you want to see is for visitation in any nursing home or facility to be temporarily suspended because of an outbreak. But we can prevent that. We can do this. That's why it's important, vitally important, that family members and loved ones follow each and every one of these requirements. It'll be explained in a moment, before and during your visit. And again, there will be ample testing of the residents and the staff, and there are rules and procedures that if we follow them, we think we can accomplish this and then move to the next step. Director Marshall Taylor, DHEC.
Thank you, Governor. Good afternoon. We understand how difficult it has been during these past few months for friends and families to be distanced from their loved ones who reside in nursing homes and similar facilities. But we believe the visitation restrictions put in place by the governor's executive order have helped to save lives and have helped to protect the health and well-being of the dedicated workers who care for these residents. We're happy to announce today that new guidelines are now in place that allow certain facilities to provide limited outdoor visitation between residents and their loved ones. There are two very important notes to make about these guidelines, which Dr. Duvey will discuss in more detail in a moment. First is that protecting the health and well-being of nurses is the center of this plan. Second is that these guidelines do not mean that visitation is available for everyone at every facility. These guidelines provide carefully developed criteria that, if met, can allow a facility to implement socially distanced outdoor visits. DHEC's doctors and medical experts have worked closely to develop these guidelines, and we hope that they restore some peace and joy to the vulnerable residents of long-term care facilities and their family and friends, while also being protective from this deadly disease. I'll now turn it over to Dr. Duvey, our Public Health Director.
Thank you, Director Taylor. Thank you, Governor. Good afternoon, and thank you all for being here as we share the DHEC guidelines for limited outdoor visitation at nursing homes and community residential care facilities, or commonly referred to as assisted living facilities. DHEC also recommends that these guidelines be used by those intermediate care facilities for individuals with intellectual disabilities. As I share some key points about these guidelines, I want to assure you that our first priority when developing these guidelines was to protect both the physical and mental health of our loved ones who call nursing homes and assisted living facilities their home. As we are all too aware, this virus has claimed at highest risk for developing life-threatening and life-ending complications. These limited outdoor visitation criteria and guidelines are based on the most recent CMS guidelines for reopening nursing homes, CDC guidance for COVID-19 in nursing homes, and DHEC's long-term care facility testing guidance, as well as visitation plans from other states. Before I begin to speak about the specifics of the plan, it's important for all of us to understand that each facility will need a reasonable amount of time in order to meet the criteria that we have outlined in these guidelines. This means that outdoor visitation will not happen immediately. In addition, it will be the responsibility of each facility to decide how it is best able to implement these guidelines and limited outdoor visitation while protecting the health of their residents and their staff and also the health of their visitors. Facilities may choose to implement more stringent visitation requirements than these required guidelines, but they are not permitted to be less stringent. Allowance for outdoor visitation will be based on certain criteria, and these include the disease transmission level, availability of appropriate amounts of personal protective equipment and staffing, and that testing is occurring at the facility in accordance with the federal CMS testing requirements. There are 3 triggers that could temporarily suspend visitation at a facility. 1, if one or more cases are identified in residents or staff members, visitation must be temporarily suspended until the federal CMS protocols for testing in response to disease at the facility are completed. This could take a few days or longer depending on whether we identify more cases in addition to the 1. 2, if 3 or more cases are identified in staff members or residents within a 14-day period, visitation must be temporarily suspended and testing must occur per federal CMS guidance. Visitation may resume 14 days after the identification of the last case. 3, for a nursing home, if testing is not occurring per federal CMS requirements, visitation must be temporarily suspended. For assisted living facilities, testing must be occurring per these same CMS protocols within 30 days from when these guidelines are issued, or visitation must be temporarily suspended. Currently, there are 90 nursing homes in the state that meet the criteria of not having cases among residents or staff within the previous 14 days. Additionally, there are 31 nursing homes that have only had one case in the last 14 days and would hopefully soon meet this criteria as well. In order to reduce the risk of virus being unknowingly introduced into nursing homes or assisted living facilities, the maximum length of time permitted for an outdoor visit will be based on the testing status of the visitor. A visitor may be allowed to visit for up to 1 hour if they present a medical record documenting either a negative result from a viral test performed within the previous 5 days, and this would be a test from a nasal or oral swab or a saliva test, or a positive result from an antibody test performed within the past 30 days. A visitor who hasn't been tested or doesn't present a medical record documenting a negative test for the PCR test or a positive test for the antibody test may be allowed to visit for a maximum of 15 minutes. All visitors, regardless of test results, must pass a COVID-19 screening prior to their visit and must adhere to the rules in place for the visit, such as social distancing, staying at least 6 feet away from their loved one, and wearing a mask properly at all times. Our DHEC staff remains committed to protecting the health and well-being of nursing home and assisted living facility residents, as well as those dedicated workers who care for them, and we will work with the facilities across the state to help them implement these limited outdoor visitation guidelines. Over the past several weeks, DHEC has performed in-person infection control surveys at all 194 licensed nursing homes in the state. In addition, DHEC staff have performed 102 infection control desk reviews of resident care facilities, those assisted living facilities, and 95 infection control inspections of assisted living facilities in the state. During those inspections, we were able to assess that appropriate disease prevention protocols were in place at each facility, and we were able to perform follow-up surveys at facilities if we had any concerns. As these new guidelines are implemented, it's also important to remember that 129 South Carolina nursing homes have taken advantage of the CMS COVID-19 Communicative Technology Grant, and they have received funding to connect residents with their loved ones and family members using tablets, smartphones, and other devices. This grant support provided a way for nursing home residents to see, hear, and talk with their loved ones remotely, helping to maintain those connections with loved ones that are so critical to mental health and well-being, while also keeping our nursing home residents protected. With these new guidelines, the governor, the facilities that care for our loved ones, and DHEC are so happy to bring those critical connections from cyberspace to outdoor spaces. And we look forward to many socially distanced but happy reunions. You can find these guidelines for limited outdoor visitation in full on DHEC's website, on the Nursing Homes Resource webpage, which is accessible toward the bottom of the main COVID-19 landing page. Questions about a facility's current visitation status should always be directed to the facility itself, as they will have the most up-to-date information. Thank you very much. And now I would like to turn it over to Director Connie Munn.
Good afternoon. Thank you, Governor, for having us here today. I'm here representing the task force. I'm Connie Munn, and I'm the Director of the Department on Aging. We have some of the task force members here with us today. Dr. Trexler with DHEC is here. I have Tim Womack, who is the South Carolina Association of Area Agency on Aging Director, and I have Dale Watson, who is our State Long-Term Care Ombudsman. We are here today to show our support to the Governor and to DHEC for these guidelines that have been released. As Governor McMaster mentioned, there are numerous, hundreds of phone calls that we all receive, and I'm sure the public as well has received the same phone calls from concerns. Our number one focus is to keep the residents safe in the nursing homes, and this task force has been instrumental in coming together to work to look at the guidelines DHEC is providing. Members who are not here today but also serve on the task force, we have AARP representation. We have the Alzheimer's Association, and the Nursing Home Association is represented as all. All are very active members of this committee, and again, our focus is to look at the DHEC guidelines that are published and to help have the message across the state that we're all in this together. We encourage family members to go to the website to review the guidelines. As you've heard mentioned here today, we don't want to go backwards. We want to continue the visitation, so please pay close attention to the guideline regulations that have been established. And our group that meets, we continue to meet on a weekly basis. They're very committed. As you can see, they're stakeholders across the state, and particularly with the Alzheimer's Association, they've been very helpful in providing guidance with loved ones suffering from dementia and how we might need to set up regulation and visitation. So I appreciate the opportunity to be here, and I appreciate the opportunity to lead the task force. Thank you, Governor.
Thank you. Thank you. Thank you. Well, as you can tell, there's a lot of thought and work went into making these plans as they have in those we've had before. Both as the virus approached and as it arrived, we took a careful, methodical, determined, step-by-step approach, and we're doing that now to move out to where we'll fully get back to life as much as we can. We realize that this visitation or the absence of it in the nursing homes and the other long-term care facilities has been a tremendous burden on people. We're aware of that, just as we're aware that the schools not being open have been a burden on many parents, and as we're trying to open them back up as much as we can now, and that is still a burden on a lot of working people, and life is still disrupted, but we're getting back to our regular functions as quickly and as we can. DHEC, the Office Department of Aging, the insight that has been made available to our team as we've developed these procedures. So with that, are there questions? Yes.